Afternoon. My name is Bill Trusky, and I have the privilege of serving as Executive Deputy Secretary of the Department of Labor and Industry. Today, it's my honor to join Representative Harkins, Senator Tina Tartagliane's staff, and representatives from the AFL-CIO as well as Indiana University of Pennsylvania to announce a new Wolf administration initiative to protect Pennsylvania workers and enhance the safety of their workplaces. In October, Governor Wolf signed the Worker Protection and Investment Executive Order to benefit hardworking Pennsylvanians across the Commonwealth, all of whom deserve fair wages, paid sick leave, safe workplaces, and quality jobs. Today, we are announcing the Wolf administration's partnership with Indiana University of Pennsylvania, IUP, to study the feasibility of extending the protections of the Occupational Safety and Health Act, better known as OSHA, to workplaces of thousands of public sector workers throughout Pennsylvania. The safeguards of OSHA standards have protected private sector workers in Pennsylvania for 50 years. All workers deserve safe, healthy workplaces, but OSHA safety standards do not apply to state and local government workplaces. This amounts to a gap in health and safety protections for public sector teachers, maintenance workers, wastewater treatment plant operators, police officers, firefighters, corrections officers, healthcare professionals, child welfare caseworkers, office workers, and so many more public servants. The feasibility study will give us a roadmap to making these Pennsylvania protections universal to all Pennsylvania workers. In addition to this feasibility study, Governor Wolf has called on the General Assembly to support Senate Bill 310, sponsored by Senator Tina Tartaglione, and House Bill 1976, sponsored by Representative Pat Harkins. These bills would make OSHA safety rules applicable for all public sector employees, aligning them with private and federal facility standards. This is the right time to take action. As of February, Pennsylvania has recovered approximately 82% of jobs lost due to the pandemic. As we all know, employers are hiring and workers are demanding better pay, better benefits, and safer working conditions. The governor's worker protection agenda meets this critical moment. The COVID-19 pandemic spared no one from having to contemplate their personal health and safety in everyday circumstances. For more than 2 years, millions of Pennsylvanians have made the adjustments necessary to protect themselves, their families, communities, and coworkers as we grappled with the implications of a new and very contagious virus. We grew accustomed to wearing masks in grocery stores, ordering takeout from restaurants, social distancing in public places, and working from kitchen tables, all to protect ourselves and each other. I believe a positive takeaway from this 2-year crisis is this: as a society, we can make meaningful changes when we decide to put the health and safety of our communities and neighbors at the top of our list of values. With this lesson fresh in our minds, the time to take meaningful action that protects Pennsylvania workers is now. Remember, safety is not just a priority, it is a value. Priorities change and values never waver. At this time, I am pleased to announce PA AFL-CIO President-elect Frank Snyder. Thank you, Frank.
Thank you, Mr. Trusky. Certainly all that labor and industry has been doing on this issue. To our policymakers who have been supportive of this for way too many years, to the governor's office, certainly to IUP for your interest, as well as putting out facts, not fiction, about a very important issue that we have been concerned about for years in the union movement in Pennsylvania. You know, I am actually, believe it or not, at the moment, the Secretary-Treasurer of the Pennsylvania AFL-CIO, and our members would be happy to know that I know a little bit about numbers, and I'm going to give you some numbers in just a moment. Before I do that, I want to give you a little personal background on myself. So it was only about 8 years after the passage of the Occupational Safety and Health Act that I went to work in Western Pennsylvania into a steel mill. I come out of the manufacturing sector, and we immediately had protection in that factory that I worked in. As a matter of fact, I know firsthand because I was, in fact, injured at work. Making steel, if you've never done it, could be a very dangerous job, just like so many of our other professions. But I was injured at work, and I was off, as a matter of fact, as a result of my injuries. Never once did I have to think about paying the rent, paying for food, paying my utilities, or any other payments that I had. Never once did I have to think about my medical payments that were due. Never once but I have to think about how was I going to go to physical therapy and be able to afford to do that. I had protection of the Occupational Safety and Health Act, just like our public sector workers deserve to have as well. More than 647,000 workers, think about this, their lives have been saved since the passage of OSHA in 1970. Almost 750,000. In 2020, the most recent year in which data was supported due to workplace illness, injury, and death, 4,764 workers have been killed due to job-related injuries. That's 13 each and every day. Another 120,000 will succumb each year due to occupational illness and disease. You do the math and you put it together, that's 340 workers a day will die still yet in the United States of America due to accidents, injuries, and workplace illnesses and diseases. Employers reported about 2.7 million injuries and illnesses in the private sector, but still over 500,000 in the public sector. No one should ever die making a living. And it's not just embarrassing that Pennsylvania is still ranked amongst the other states that don't get this with their policymakers. We have friends, to be sure, and we need to encourage that friendship and build upon those allies. As far as those who do not support this and have not supported it for years, we need to find out why. And yes, we're going to have a study done by IUP, and we welcome that study. But I'll tell you, I can just give you a version of what I think will come out of it, not out of their study, but what we've heard out of some of the folks that have opposed this legislation for years up here, because they talk about money, 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 money. We are better than that in Pennsylvania. This cannot be an issue about money. Hear what I said. 340 workers each and every day aren't coming home from work just because of their job and their occupation. Hopefully, folks are going to come together. Hopefully, this is a bipartisan effort in which we can stand together because we are better than this in Pennsylvania. We want to do everything that we will continue to do and that we have been doing for years now to try to push this legislation through. So with that, I do want to bring up, my colleague, my partner, and he is the president of the Pennsylvania AFL-CIO, and talk about his perspective from the public sector and others. President Rick Bloomingdale.
Thank you, Frank, but not for long. As everybody may or may not know, last week we had our convention in Pittsburgh, Pennsylvania, and as we do every 4 years, we run for election. And I chose not to run for re-election this time. I'll be hitting 69 here and this month, and time to pass it on to a younger generation. And Frank Snyder was elected as president unopposed, and Angela Ferrito was elected as secretary-treasurer of the Pennsylvania AFL-CIO. So with that little bit of history, let me talk about some of what we've done over the last 30 years that we've been fighting for this. When I was with AFSCME, before I went to the AFL-CIO, we first introduced public sector OSHA back in 1990, and we have been fighting for it for 32 years now. And, you know, Frank mentioned that the fact that they always say it's too expensive, but then they also say we're doing our job, our workplaces are healthy and safe. Then if you're healthy and safe, OSHA's not going to require you to do things that you aren't already doing if you're doing them. So it shouldn't cost anything. So where is the cost if you are having a healthy and safe workplace? So what we know is that, like in many places, folks cut corners. don't always follow the right procedure, and people get killed. We see PennDOT workers, we see corrections officers, folks getting killed on the job for doing nothing but going to work because their workplace is unsafe. In some ways it can be prevented, in some ways it can't. Obviously, there are work sites like a fire or a prison where things happen that can't be controlled, but within the law and within the regulation, within what you can do within OSHA, because we have federal prisons and they are covered by the federal OSHA. We have private prisons, not in Pennsylvania, but they are covered by OSHA. Why shouldn't our corrections officers in PA have the same coverage that those do in the private sector? One other example that I use a lot of times is you drive down in the city of Harrisburg, you'll see men and women collecting trash on a trash truck. You go out to my township, Lower Paxton, you'll see waste management. Now, same truck, drivers, people doing the same job. One has OSHA, one doesn't. What's the difference? The employer. It's not that the job is inherently safer picking up trash in Lower Paxton or Harrisburg. It's who is the employer. Inherently unfair because of who you work for. So I am thrilled, after having pursued this agenda for 32 years, this legislation for 32 years, to see that Governor Wolf has decided to take the step to try and implement things at the state level, making state workplaces more healthy and safe, but also pursuing a study so we can get a handle on what the real problem is. What is the extent, not the real problem, it is a real problem, the extent of the problem out there. How many injuries are happening? That's one of the things we don't know because there's no reporting standard like there is for OSHA. No cities and counties don't have to report workplace injury data. So there is no real understanding of what the scope of the problem is. One of the other issues, Frank mentioned he worked in a steel mill where OSHA is prevalent, but chances are the public is not going to go into that steel mill. The public goes into the public workspaces every single day, whether it's your township office, whether it's the L&I building, whether it's a state mental institution, whether it's a correction facility to visit an inmate, whether it's a school to pick up your kids. All those things would be impacted by a strong OSHA law and strong state protections, and if we expanded OSHA to all the local governments. And now, the only thing of protecting your kids in your school is folks pushing back against it in the public and talking about what needs to be done. We've seen in Philly where they have an incredible problem getting their schools up to some kind of code where they have proper ventilation. We found this out especially during the pandemic, right? We still see pictures of puddles on the floor and hanging ceiling tiles and exposed asbestos. None of that would happen under OSHA. And we would have the ability to make sure that those places where our children go every day are healthy and safe. And that's why this is one reason that we continue to push for OSHA. It has to be about our citizens who visit government buildings, and it has to be about our workers who work inside those government buildings or on the roads repairing our highways. The guys building the highways and gals, they have OSHA. The folks repairing the highways in PennDOT don't. And it's just time to fix this issue. It's been 32 years since we first introduced this legislation. It's time that it gets done now. Thank you very much. Pat.
Thanks, Frank.
Representative Harkin, the sponsor.
That's all right. Thank you. Great to be with you. First off, I'd like to thank Governor Wolf, the Labor Administration, and all those along the way who have helped with this bill. It was originally introduced by me 16 years ago, House Bill 1082. We called it the Jake Schwab Worker Safety Bill. Jake Schwab was a mechanic at the Erie EMTA bus facility, and mid-November he was given the wrong size jack to jack this bus up that he had to work on. Unfortunately, it came down, crushed him. He's deceased. He's left a great family, a great wife, who are all heartbroken and sick about what happened. The sad part of this situation is, under the current law, they don't have to, the insurance company that investigated this doesn't have to give any information to the surviving people, the family, the spouse, and everything else. There's so many wrongs involved currently, and as has been discussed with prior occupations, I drove a truck for UPS for 25 years in Erie. Drove over the road for a couple summers, got my feet wet with semis and tractor trailers, but every time I'd come into work, I had safety and protocol driven into my brain, whether I liked it or not, and at the end of the day, I realized what the reason for that was, how good it was for everybody. And I often think of the insurance industry, how they're here every week and they're beating their drum. They should be out front leading with this, not only for people who are killed, unfortunately, but also for those who survive and the quality of life that they have to live with, their family members. Just a coincidence, the surviving spouse of Jake Schwab was given a stipend, a settlement. No, I didn't care to know what it was, but she told me, Tiffany Schwab had informed me when I ran into her one evening shopping with my wife, that if she were to remarry, she would have to give this money back. And I just thought, how cold-hearted is that? But I checked with a couple attorneys who know those kinds of things and deal with that daily, and sure enough, they were right. That's how cold-hearted our society is with these kind of things. But I think today, if the bill was put on the House floor and it was put up for a vote, I think the votes are there and it would pass. I think people are kind of feeling it out. They're starting to hear from the general public. They're starting to hear from the workers who are impacted by this in a negative way. And I think it just needs a push from some people. And if you're a public sector worker and you're not covered, speak out. Write a letter to the editor. Contact your local news people. I receive calls anonymously. I receive emails on my home server from people who will say, hey, by the way, I work for X, Y, and Z. I can't tell you this openly, but check this water line, check what we do when we replace these things in frozen ground. I got a call from somebody in Philadelphia about an electrical grid that was a major catastrophe waiting to happen. That was 3 years ago, and I understand it was corrected. Same situation, air quality in buildings in Pittsburgh. I travel all over, I look at these situations, I take pictures and I document it, but until someone is killed or hurt seriously, do we get any media attention? Last summer, I had a guy call, a reporter who's locally known and all concerned about me and my expenses. And I said, yeah, you're right. I said, I drive a long way. Believe me, I try to look out for the taxpayers' dollars, but at the same time, how about looking and seeing what I'm doing with those taxpayer dollars? I'm looking into these people who are abusing the system with these worker safety issues. He didn't care at all to address that House Bill 1082 at all, one iota. Unfortunately, the next day, a PennDOT employee was killed in Elk County, and I texted the gentleman and I said, why don't you look into this? Never heard another thing out of him. That's what we're dealing with. That's what we need to overcome. I'm ready to keep fighting. I'm going to be here another 2 years, I think, and I'm ready to give them hell. Thank you.
Hi, I'm Will Galgott, Senator Christine Tartagliane's Communications Director, reading remarks on her behalf. She's unable to be here today. But the expanding of OSHA protections to our Commonwealth public workers like teachers, firefighters, road maintenance workers, and other dedicated public servants should be universally popular. Those that spent their careers supporting our communities and ensuring government can continue to provide services deserve our adoration and support, not for us to turn a blind eye to the dangers they can face in the workplace. If we are willing to mandate private employers provide safe workplaces, we must also demand the same from ourselves and our local governments. I was delighted when the governor issued his executive order to study what expanding OSHA to public sector employees would look like in Pennsylvania. Many other states that have already expanded OSHA to public sector employees have undertaken similar studies as what's in the governor's executive order. They compiled and analyzed data, gathered best practices from other states, and considered the staffing and regulatory changes needed to successfully implement an expansion of OSHA. So I see this as a feasibility study and best practices learned as hopefully the first steps in expanding OSHA to millions of employees across the Commonwealth. Senate Bill 310 is co-sponsored by a bipartisan group of legislators This common sense measure would increase worker safety for state and local government workers, teachers, and thousands more. I look forward to continuing the fight for the public servants that deserve to have workplaces that are just as safe as those in the private sector. Thank you. Now I'm going to turn it back over to Bill.
Thank you all. Is there any questions?
So is this going to be like, you say feasibility study, like cost benefit, like what are you hoping to get out of the study? Like what is the main finding that you guys are looking for? Like total number of people injured in the public sector workforce in Pennsylvania every year? Like I guess I'm just trying to get a better sense of like what will be studied.
We're going to examine the numbers, the data, the injury, and just so you know, this only affects the Commonwealth. It doesn't expand into local municipalities. No, we plan to look at the data around injuries in Commonwealth workplaces, look at the differences between what safety measures the Commonwealth has in place, what OSHA requires.
Okay, so it won't look at injuries for people who are working in like, for the city of Pittsburgh, just pull one out.
Not yet.
Or like a random township.
Correct.
Okay. And I guess just like, sorry.
No.
Okay. Are you concerned about, you guys are asking for it, the study, obviously everyone here commenting on whether it's a good or bad idea wants this done. IUP, I guess, how are you going to be able to, process, like, the Wolf administration is requesting it, seem to kind of have an editorial position on what they want done with the results. They want to use it. It seems to push for this reform.
Thank you.
So the feasibility study, we are going to use existing data to show pros and cons of moving into that direction. So what we are planning to do with this feasibility study is to show where are the gaps that currently the state may have in order to be accomplished with a potential OSHA state plan. So that's basically what we want. So we don't have a specific position in favor or against. So what we are going to do is just, as a team, identify how far the state will be into just being to be an OSHA state.
And what's your name?
Luz Marin.
Okay.
I am the principal investigator for this project.
Okay. I think that's all my questions.
Anyone else? Thank you all.